Hello again, everyone. Mark Hack, Macomb County Executive. I want to stay specific on what's going on with the vaccination. As you know, there was a challenge early on. I think we kind of got off message with the state. The messaging before was, the amount of supply we have was able to cover the demand. That was in phase 1A. When the announcement was made that we opened it up to so many others, again, here in Macomb County, approximately 30,000. And I was kind of hopeful that it was going to be more targeted specific for our senior citizens, the population that all the science data statistics, and even those in the healthcare system say are the most vulnerable. I think we could have worked or managed through whatever supply we had to kind of help deal with that. But opening it up to other target groups, I get it. I understand that's the need, the interest to want to do that. But you can't do that unless we have the supply to follow. So the problem is now we're saying there is a tremendous demand and we're trying to get some more from the federal government. We should have waited till we got more from the federal government to deal with this. So why I say that is because there's going to be a continued frustration on behalf of people with the minimal amount we have in availability of appointments that are going to be out there for you. Yes, it's going to be tomorrow, again, Tuesday, where you can go ahead and sign up for appointments for the entire week. And the way that's set up, us getting vaccines from the state and how we schedule appointments is going to go once again through this Wednesday, through next Tuesday. That's how the system is set up and the delivery that we get from the state. So to simplify it, the easiest thing to say is you got a chance on Tuesday to go ahead and sign up. I know our sites say that you can go ahead and call this line or go ahead, now we're going to be doing something online. I'll get to that specifically. You can go ahead and call in Monday through Friday from 8:30 to 5 p.m. But I'm going to tell you, that first opening opportunity on Tuesday for people to call in or go to our new ability to do this online is going to be filled up like that. It's going to go quick. We asked for 50,000. We know we can manage that and probably more with our outreach and the support that we have. But again, at least we went from 1,000 this time to just under 4,000. So we went to 1,000 to 4,000, but I'm going to go back to the demand side of this. 300,000 people here in Macomb County qualify for those approximately 4,000 now. And we don't believe 3,000 people are going to take it. Let's just say half of them may have an interest and really want to do it. And I'll even take it further than that. Let's just say a simple 10% of the people want to take it. That would be 30,000 people that are saying, I want that vaccine, I want it, and it better be available. They're going to be adamant about getting to that phone line and or our new option to do it online, and they're going to find out that it's going to be, once again, chaotic, it's going to be clogged. In fact, the phone line system, whatever, you're going to get an opportunity to call in. You may get somebody that answers that phone right away. More than likely, if you're not the first person calling at that time at 8:30, it's going to go right away to a hold situation where you may be on hold. Or it may go to something where they're going to say, you know what, busy right now, call back. And we know this is going to happen. There are going to be so many people calling. Verizon messaging that comes in when the system is overloaded is going to say your call cannot be completed as dialed. So when that comes in, it's not that there's something wrong with the phone line or there's something happened to our thing. That's when the system gets overloaded. And that did happen last Tuesday. It's going to happen this Tuesday. We pretty much know that. And then the last thing you're going to hear as you keep calling is eventually it's going to be filled up shortly. We anticipate within less than 1 hour when we open it up, 8:30 on Tuesday, most likely by 9:30, you're going to start hearing that final message that says they're filled up. And you're going to have to wait another week before we have the availability of vaccine. I can't stress it enough. We were given very limited, and yet there was an increase in the amount of people that were available to go ahead and take this. So it is a challenge for everyone. I mean, there isn't a health department in the state that isn't challenged by this because of the new opportunity for people to sign up, even healthcare. People are also asking, why did we get 4,000 now instead of the 1,000? What happened? Did the federal government give more? No, we understand is the state gets about 60,000, and there was a 50-50 split between the health departments around the state and the healthcare systems, the hospitals. So we think what happened because they realized, creating this demand caused quite a stir for a lot of health departments around the state. And with that, they decided to go ahead and make, I think the split is now 75-25. So they're taking away from what they were originally given to the hospitals and now giving it to the health department. So we got that bump, but again, at a detriment to, I think, our hospital system. So until there's more of a supply coming in from the federal government or the state has more on hand, this is going to be a continued frustration for people. And I think it goes beyond frustration because some people are downright angry about it. And I think as we continue in the messaging, we want to make sure people understand we got ahead of ourselves. I think at the state level, way too quick without realizing, you need to first bump up the supply before you open up and tell people, okay, now you can go ahead and demand it and we have it available. So I know I keep saying that because you are going to be frustrated again. We're opening it up Tuesday. Again, you can call in. You can call in now and you're going to be able to make your first and your second dose appointment. The callers are going to be able to give you your first date for your first appointment for the first shot and the second date for the second shot. understand that the shots are very much the same. It's just the allotment that we get to deal with this. So you will call in at that number, 586-463-8777. 586-463-8777. You can call that number. And again, that's going to start Tuesday morning at 8:30. You can keep trying to call sooner than that. The phone lines don't start, they don't open them up till right at 8:30. And if you're one of the lucky ones that actually get to get through to an operator at some point in time, you're going to be able to schedule it. But I'm going to tell you, there are going to be a lot of people that are going to be extremely frustrated as a result of this. So we know that, we anticipate that. The other option is new. The other option is just going to give you the availability to either go ahead and sign up for your first dose. You won't have an option here to go ahead and sign up for a first and a second dose. You can either sign up for just your first dose, or if you're a person that's already had your first dose, we already know the numbers of those people, you will have an opportunity to go ahead and sign up for your second dose. There's going to be an option here when you click on. You go to macombgov.org, where you can actually go ahead and make your appointment. So vaccine appointments, vaccination appointments, you click on that icon. It's going to give you an option. You know, the first dose people have an option, and the people that were looking for their second dose will have an option. You go to that one that's appropriate for you, and you're going to be able to see the schedule there and sign up. Now, with this being said, we realize it takes in probably about 6,000. This system that we have takes in about 6,000 people at one time. Obviously, that's more than what we have availability for the actual scheduling appointments. So when I say that, you too are going to see that probably within the first, I'm going to say 2 minutes, those are going to be filled up. And you're going to be frustrated because you realize, you know what, there's not enough available spots. We know that because there's not enough available vaccine. So we go through this over and over again. As I showed in an earlier video or whatever, we have 5 ultra cold freezers right now to handle us. We're not even using one. We're not even using one to its full extent. So we have 4 of them sitting there. One of them we're actually using as a prop right now to show people that there is no availability. So, and we don't believe that that's going to be changing anytime soon. We're hearing probably till the end of this month, it's still just going to be 60,000 available statewide. So folks, this is an incredible challenge. We want to try to figure out how do we turn that messaging back around to where it was originally, but we're not able to do that because the demand side has been opened up. So again, it's just going to be one of those things, if you're fortunate, you're going to be able to get an appointment. And we've been getting calls. I know even personally people are calling me saying, hey, can I get in? Can we get ahead of the line? Can we sneak in? It doesn't matter who you are. It's not happening. Again, the only fair thing to do is to open it up for people based upon that phone number that we have given, 586, once again, 586-463-8777, or go to macombgov.org and click on that icon. Those are the only 2 options you have to go ahead and, get a chance to go ahead and get an appointment. So with that, Tuesday, it opens up again. And after that, when they're filled up, again, the scheduling goes from Wednesday through next Tuesday. Next Tuesday, we will open it up again for the limited supply that we have available. So, you know, we apologize deeply. We wish we had more. We want to vaccinate everybody, and we have the capacity and the ability to do that. As I mentioned, just the county itself can do 50,000. And we're hoping by the time we get more supply coming into the state, it's not just going to be health departments with this responsibility. You're going to have urgent cares. You're going to have some of the pharmacies. You're going to have your own doctors that are going to be available to do this, as well as the hospitals and many other outreach opportunities, like we do with the normal flu vaccine. But for some reason, the supply isn't here, and that's understandable. Yet, you know, we need to make sure that we're mirroring the 2, supply versus demand, and that kind of got a little bit ahead of us, if you will. So with that, I'm asking for your patience and understanding as to what is going on here, not just in Macomb County, but all across the state when it comes to vaccinating and the challenges we're faced. So hopefully, you're lucky enough to get one of those appointments. If not, please don't be frustrated, and try to be patient with us as we get through this. And in the meantime, as I always say, you know, this thing hasn't gone away. It's still a challenge for all of us here in this state, throughout the country. And you know, we want you to continue to manage, follow the CDC guidelines to continue to keep you and your family safe.